Welcome back to Have More Babies. You know, as parents, probably one of the biggest decisions you'll make centers on your kid's health.
Oh, absolutely. It's huge.
And, well, right at the heart of that is picking the right pediatrician. It's, uh, it's more than just finding someone for a fever, right? It's about finding a real partner.
A partner in their well-being, exactly. And pediatricians, they're specialists. They've spent years really digging into, you know, the social, the emotional, the physical growth of children.
All the way from newborns.
Right up to young
Mm.
adults. They're honestly a cornerstone for healthy development.
And that's exactly what we're digging into today here on Have More Babies. We're taking a closer look at what really makes a pediatrician exceptional.
Yeah, what sets them apart?
Our insights today are actually drawn from Omega Pediatrics, and our mission, well, it's pretty straightforward. We want to help you understand the key things to look for when you're choosing that doctor for your child.
Because a great pediatrician is, well, they're just such a vital resource for parents, aren't they? They give that invaluable guidance on, the early stuff like feeding and sleep routines, which can feel overwhelming.
Oh, tell me about it.
Right. And then navigating like developmental milestones, behavior patterns, all of it.
Exactly. They're the experts you turn to for, the usual childhood sicknesses, the bumps and scrapes that are bound to happen,
Definitely.
and even for managing tougher things like chronic conditions. Their specific knowledge makes them uniquely qualified.
Yeah, it really does.
Hmm.
So what are we actually looking for? What are those hallmarks of a truly great pediatrician? Based on what Omega Pediatrics highlights, there are, well, quite a few key things.
Okay, let's jump in. First up, something really fundamental. Practical communication skills. And we don't just mean like using simple words.
No, it's more than that.
It's about their knack for really connecting, right, with both you, the parent, and your child, explaining things clearly, concisely, making sure everyone gets it.
Yeah, and you know what's interesting? Good communication here also means like active listening, making eye contact with the kiddo,
Yep.
and kind of tailoring how they explain things to the child's level. Like think about explaining why taking medicine helps them get back to playing. That's real practical communication.
That's such a good example. Okay, next, being knowledgeable. I mean, obviously, we expect doctors to know their stuff.
Of course.
But with pediatricians, it's about that really deep, specific training in child development and health, and crucially, staying current,
Yeah.
keeping up with medical advancements.
Absolutely essential, especially in a field that changes so fast. Think about how much our understanding of, say, childhood allergies has grown, or the impact of early experiences on long-term health.
Right.
A knowledgeable pediatrician isn't just coasting on med school knowledge. They're actively learning, looking at the latest research to give the best care.
Okay, number 3, empathy. This one feels, I don't know, extra important with kids. It's that ability to really get it, understand and share what a young patient might be feeling.
Yeah, connect emotionally, especially if the child is scared or uncomfortable.
How does that play out practically?
Well, think about a kid who's nervous about getting a shot. An empathetic doctor won't just, jab them and move on.
Right.
They'll acknowledge the fear, explain what's happening calmly, maybe offer like a sticker or just a kind word afterwards. It builds trust, makes the next visit easier.
That makes so much sense. Following that is patience. Kids, well, they often need a bit more time, don't they? A bit more explaining. So a great pediatrician gets that. They're willing to listen to that sometimes rambling story about what hurts.
Yes. The long version.
And answer all the questions and just be patient with their needs.
Exactly. Because a rushed appointment, it leaves everyone feeling unheard. Patience lets the doctor build rapport, get the full story, and give better care. Simple as that.
A positive attitude is also listed as key.
Yeah.
That warm, friendly vibe. It can really change the whole feel of a doctor's visit for a child.
Oh, absolutely. Makes it less intimidating, more welcoming. That can make a huge difference in how comfortable a child feels opening up.
Think about it from their shoes, right? Like walking into a clinic can be kind of scary.
Totally. A smile, a friendly tone
Yeah.
goes a long way to easing that anxiety instantly.
Okay, then we have flexibility. Kids' health needs can pivot really fast.
Super fast.
So a fantastic pediatrician needs to be able to adapt, think on their feet, and importantly, work with parents on the best plan, even if plan A needs adjusting.
Right. And that flexibility, it also means understanding that, families have different views, different approaches.
Good point.
A great pediatrician respects that and collaborates to find solutions that work for the family while always prioritizing the child's health.
Professionalism. That feels like a non-negotiable. This covers keeping cool under pressure,
Definitely.
being dependable, punctual, showing real consideration. It's about being reliable, building that trust.
Yeah. Imagine like a sudden health scare with your child. You want a professional who handles it calmly,
Mhm.
efficiently, gives clear guidance, reassures you. That composure builds so much confidence.
Absolutely. Now, something that strikes me as really critical, attention to
Oh,
detail.
yes. Crucial.
With kids' health, the little things can matter a lot. A great pediatrician is thorough, looking at every angle to get the diagnosis right.
That careful approach, that attention to detail, can catch early warning signs, subtle things that might otherwise be missed. It's really about seeing the whole child, not just the obvious symptom.
Number 9 is being respectful, and this ties back to communication, I think.
It
A
does.
top-notch pediatrician really listens to what parents are saying, values their insights, because who knows the child better?
Exactly. Parents have this incredible insight into their child's baseline, their behavior, subtle shifts.
And sees them as partners in care.
Yes, that partnership is fundamental. A respectful pediatrician uses that parent expertise in their assessment and planning.
And the last one on the list, advocacy. The best ones don't just treat colds.
No, they go beyond,
They become advocates for their patients, for the families, offering support, guidance, helping navigate the sometimes confusing healthcare system.
right? Maybe helping find specialists or connecting families with support groups or even helping with school-related health needs. It's about the child's whole world, their overall well-being.
Wow. Okay, so it's clear choosing a pediatrician isn't just about checking boxes for degrees or location.
Not at all. It's multifaceted.
These 10 qualities, communication, knowledge, empathy, patience, attitude, flexibility, professionalism, attention to detail, respect, advocacy, they really paint a full picture.
They really do.
And digging deeper into communication and empathy, why are they so highlighted?
Well, they're really the foundation for trust, aren't they? Effective communication, listening, explaining that builds the relationship.
Makes sense.
And empathy, well, that allows the doctor to truly recognize and address the emotional needs of a child, not just the physical symptoms. Understanding their worries, their hopes, even their fears. It leads to much better, more tailored treatment plans.
So it's not just about being nice, it actually impacts care.
Directly impacts care. And that ties into professionalism, too. It's not just about being punctual, although that's important.
Right.
It's about providing consistently high-quality care, being trustworthy, attentive. It's also about how they handle stress, work with the whole healthcare team effectively.
And part of that professionalism is committing to learning, right? Keeping up.
Exactly. Top-notch pediatricians are dedicated to continuous learning, staying updated through conferences, research. It's a constant process.
Which leads back to better care. Now, you mentioned tailoring plans. That one-size-fits-all approach really doesn't work in pediatrics, does it?
Oh, absolutely not. Every child is unique. A great pediatrician knows that. They take the time to really get to know each patient, their specific medical history, sure, but also their personality, their developmental stage.
What are the benefits of that really personalized approach?
Well, huge benefits. Early identification of potential issues, for one, preventing misdiagnosis. It takes patience, sometimes some creativity, and definitely adaptability to deliver that truly individualized treatment.
How do they build that deep understanding?
It comes back to relationships. Building strong connections with the child and the family, that helps them understand the medical history, lifestyle factors, environmental influences, the whole context.
And technology must play a role now, too.
Oh, definitely. Things like electronic health records, EHRs, are vital. They help track that detailed history, ensure continuity of care, even if the child sees a different doctor within the same practice. Everyone's on the same page.
Speaking of technology, what other tools are common in pediatric practices now for diagnosis and treatment?
Well, there are some neat advancements. You see handheld devices, for instance, that help diagnose ear infections much more accurately, detecting fluid, signs of infection, checking eardrum movement,
Oh, interesting.
and pulse oximeters, those little clips they put on the finger.
Hmm?
Super important for measuring blood oxygen levels. Crucial for newborns or kids with asthma, pneumonia.
Right, I've seen those.
Common lab tools, too, like the rapid strep test. Quick results right in the office. Plus other basics like blood work, urinalysis for diagnosing all sorts of things.
And for more complex issues.
You've got advanced imaging like CT scans or MRIs. They let doctors see inside non-invasively, check for bone fractures, even brain issues without surgery.
Wow. Technology is really advancing care. What about connecting remotely?
Yeah, telemedicine, It's become a big deal, especially for families in rural areas. Allows for remote consultations, follow-ups, improves access.
And online portals.
Many practices have portals now where parents can access health records, maybe message the pediatrician with non-urgent questions. It boosts that communication and partnership we talked about.
It all comes back to that relationship with parents, doesn't it? Building trust and respect.
Absolutely. It's a three-way street. Doctor, child, parent. They work with parents to create those treatment plans that fit the child's specific needs.
And that requires
Open communication, definitely. Being accessible, attentive, and having a proactive approach to treatment, not just reactive.
You mentioned continuous learning earlier. Why is that so vital when you're picking a doctor for your child?
Because medicine evolves constantly.
Right.
New research, better treatment options, they emerge all the time. A pediatrician has to stay updated.
So they should be attending conferences, reading journals.
Yes, exactly. Committing to lifelong learning through conferences, seminars, professional development. It's not optional if you want to provide the best care.
And that dedication directly translates to more accurate diagnoses and access to the latest, most effective treatments for your child.
Precisely.
So wrapping things up, choosing the best pediatrician, it's clearly about more than just the diploma on the wall or how close the office is.
Much more. It's about those qualities we've discussed.
Yeah.
Respect, empathy, professionalism, being adaptable, paying attention to detail, competence, that positive attitude, integrity.
It's the whole package.
It really is. And, Omega Pediatrics puts it well. They emphasize that undoubtedly at Roswell Omega Pediatrics, you are assured you have the best doctors for your child.
That's a strong statement.
It reflects that focus on understanding each child's unique needs. They also say, at Roswell Omega Pediatrics, we realize that every child is unique, and we take the time to understand and cater to their specific requirements.
That customization again?
Exactly. It underscores their commitment to personalized, specialized treatment. They wrap it up by saying, with Roswell Omega Pediatrics, you can trust that your child will receive the utmost care and attention from a team of compassionate, highly qualified medical professionals.
That really brings together all the points we've covered. The compassion, the qualifications, the attention.
It's all intertwined.
So the key takeaway for you, our listeners, is that finding that great pediatrician involves looking for this blend of skills and personal qualities.
Right. The knowledge and the connection.
And maybe a final thought to leave you with. As you think about your child's health care, consider which of these qualities, empathy, patience, communication style, really resonates most with your family's needs and your own approach. What feels most important for your partnership?
That's a great question to reflect on.
Definitely something to mull over. And for more detailed information on all these aspects and to connect with experienced pediatric professionals who embody these qualities, we strongly encourage you to visit omegapediatrics.com.
A great resource.
Absolutely. Thank you so much for joining us for this discussion on Have More Babies.
My pleasure.
If you found this useful, please do give this video a like, subscribe to the channel for more discussions like this, and maybe share it with other parents who are navigating this important decision too.
Thanks, everyone.
Goodbye for now.